Good afternoon, ma'am. Good afternoon. So, may I know your name, ma'am? Master Giganto. Okay, so I am Doral J. Giganto, ma'am, your nurse for today. And so, I'm here, ma'am. I'm visiting your home, ma'am, to assess you and to give you some treatment since I have noticed, ma'am, that may da ka sa manha imo right nga knee. So I'm going to,
Ayun,
so yan na
solid,
ma'am,
solid.
I'm going to place all my equipment. Excuse me, ma'am. So, so before I begin in providing you a treatment, ma'am, can I ask ma'am kung ngayon pwede ako maghugasin kamot? Dala ko si Okay, thank you. Okay, so now I'm going to perform my hand hygiene. So we need to first wash our hands. Okay, and then get the soap. Okay. So it is very important to wash our hands to avoid contaminating the wound of the patient. Now I'm going to wash my Wash your hands thoroughly. Then I'm going to dry my hands with towel. Okay, so I'm done with my hand hygiene. Then let's go back to the my patient. So now that I am done with doing my hand hygiene, I am going to put my apron. Now that I am done with putting my apron, I'm going to get all the materials or the equipment that I be needing in doing my wound dressing. So we have here the adhesive tape. This one. And my cotton applicator. Then, of course, the alcohol. And the gauze. And then, we also gonna be needing 2 gloves. I'm going to set aside the bag. So these are all my the equipments that I'll be needing for the wound dressing. So first is we're going to perform again hand hygiene to make sure that our hands is clean. So that will not get contaminate the wound. The wound. Okay, ma'am, you may sit down. So I am going to put on some gloves to make sure that the patient's hand won't then we are going to examine the patient's or the client's wound. So as you can see, there are some skin breakouts and there are no bleeding anymore. So we can also observe that the patient's wound is not did not get wound dressing before. So I think, Pam, is it your first time to get your wound dressed up?
Yes.
Okay, so as you can see, it's not bleeding anymore and the wound is continue to heal. So now we're going to dispose this one. So now I'm going to use another gloves. This is to ensure that, again, as we are going to apply the the treatment, we have to make sure that our hands is very clean. There. So first thing is I'm going to get applicator. And so we are going to put some betadine to make sure that the client's kuan is clean. So put it back again.
Mabutlaw pa yan. Ikaw ang samok.
So, where's your wound, ma'am? So, I'm going to apply some betadine on the wound of the patient. So, betadine helps to clean the patient's wound. So, we're going to dispose it and use another applicator. I'm going to so right now is we're going inside the is it Does it hurt, Mom?
A little bit.
Okay, a little bit. Okay. Okay. So next is we are going to apply the gauze. Then, ma'am. So can you, ma'am? So we're going to put bandage on the middle to make sure that it is secure. So, okay, so as you can see, we make a little mess because the betadine spilled, but it is okay because we already done with the wound dressing. And now I'm going to dispose the gloves that I used. Make sure you don't touch that on because it's very dirty. So now we're going to dispose this. And then don't forget to confirm hand hygiene again. Okay, so the next thing that I do is get my bag and make sure that you clean your mess. Okay, so clean my materials. So I'll put the here. Here. Okay. So let's not forget to get our hands on. And then I'm going to take my apron. Okay, so we're going to there. So since we can no longer use the paper lining, because the betadine is still on it, so we're going to dispose it also. There. And also the plastic. Okay, so I'm going to close my bag now. So before I leave, sorry. Okay, so before I leave, ma'am, I just wanted to tell you that of course you have to make sure that your wound will not dili siya mahugawan ng, okay? Don't expose it too much sa dust, okay? It will it can cause na ma-infect imong wound and mudugay siya mo ayo. And also, ma'am, please make sure to kanang premium nimo siya, i-maintain ang iyang pagbutang og ingani, pag dressing sa wound para mas madali pag ayo ang imong saman. And if you don't know, ma'am, how to put it, how to do it, how to dress your wound, you can ask your mother. And but if you can, since you already how old are you, ma'am? 11. Oh, since you're 11, I think, ma'am, that you already know how to, as what have you seen kanina, I think you also know na how to dress the wound. Okay. So, thank you so much, ma'am. Okay, so, but if I'll visit again, ma'am, I will be conducting again a home visit. I will let you know, ma'am. So, thank you so much, ma'am, for your cooperation. So, for this demonstration, I think, also, before you leave, make sure that you record all the important dates and all the things that what you call this, make sure na imong i-record all the things that you have observed in the client's wound. So that's it for the video.